Good evening, good morning, everyone. Today is Monday, November 8th, and this is a session of our Health and Human Services Committee. And today there are two items on the agenda. We will be discussing an update of the county's emergency homeless shelter system, and then have a work session to discuss amendments to the FY21 through 26 capital improvement program. I am now going to turn it over to our colleague and friend, Councilmember Glass, who has very ably led the council in addressing and being the lead on issues of homelessness and vulnerable populations. Thank you to Councilmember Glass and his team for his continued leadership in this important space. And he will be chairing us this morning. I now turn it over to him.
Well, thank you very much, Mr. Vice President. I appreciate the collaborative work of this entire committee. We have been doing an incredible job here in the county of making sure that everybody is healthy and safe, especially during a pandemic, right? And that the safest place to be is in a home. And I really appreciate the partnership and collaboration amongst the three members of this committee, of course, of staff, our entire teams, and Montgomery County government across the board. And so this morning, we're going to be getting an update on our shelters, and particularly the new shelter that is being built right now. And so I want to thank HHS, Interfaith Works, and Montgomery County Coalition for the Homeless for joining us in this conversation this morning, what I hope will be a constructive conversation. And just a few weeks ago, I was able to visit the construction site for the new Neville Street shelter, which is a two-story, 30,000 square feet building. And it's going to be a year-round shelter with 200 beds, and it's going to be incredible. There's a dining hall, even a computer lab, and this building is going to be so much to so many people as we help provide shelter for those who need it the most. We'll be able to provide them with warm meals, with medical care, and also case management to provide the holistic services that we know individuals need. And the pandemic, I think, has taught us a lot of things, or let me say, I know the pandemic has taught us a lot of things. And as it relates to this space specifically, it has shown us that we need to continue social distancing, that we need to have a year-long safe shelter, and that we need to have services and staff dedicated specifically for residents experiencing homelessness. And the goal that we have shared across county government is to make sure that residents are safe and healthy and that they have a roof over their head. And that was extremely important because when the pandemic started, we saw what was happening in a number of cities, particularly in San Francisco and Portland and Seattle. And the COVID cases there spiked incredibly high among individuals who were experiencing homelessness. And we made sure that that did not happen here. And I am so proud that everyone's efforts has resulted in our homeless residents having a positive COVID caseload of case rate of below 2% throughout the entire pandemic. And that is a testament to everybody's work because we socially distanced and we made sure that there were shelters and we made sure that they had all the services they need. And that includes HHS staff and even more importantly, our social service providers and their teams, that they had all the resources that they needed. And when we took this action back in March of 2020, we didn't think that we'd still be here nearly a year and a half, almost 2 years later, as we're now embarking on winter season. But we still have more work to do. And it was just a few months ago that I was actually in Long Branch walking around with community leaders there. I joined Cheer and residents in the Sligo Brandview community. And we talked about the Long Branch Rec Center, and we talked about the library, and we talked about the Caulfield Center as well. Facilities that had been closed for too long, but that we know need to be reopened. And I am absolutely confident that we can provide shelter for individuals who are experiencing homelessness, and we can return these facilities back to the communities because these are not mutually exclusive goals. And so I am looking forward to this conversation and the updates that we're going to have in a few seconds to talk about the path forward and talk about year-long shelter for those experiencing homelessness and our plans to reopen the recreation centers as well. So Ms. McMillan, let me see if any of my colleagues have anything that they want to say. Councilmember Rice, I don't know if anyone else is joining us. You're good? Okay, awesome. And Vice President Albornoz, you're good. So right now I'll turn it over to Ms. McMillan to lead us through the packet.
Thank you. You will receive an update from the Department of General Services and the Department of Health and Human Services on what is happening with the homeless system. Our system is set up for all the reasons that you just mentioned, to keep people safe, to keep people healthy, also to make sure that it has the supports to make homelessness rare, brief, and non-recurring, which continues to be our goal. And I do want to emphasize that while we're talking about the emergency shelter system today, that everyone, all of our partners and HHS have continued to move people into permanent housing throughout the pandemic. That goal has stayed in place. So they will provide you with an overview of the system. It is important to recognize that once the Neville Street facility opens, then our partners will readjust through the facilities that we have that are dedicated to the homeless system. So it's not just one thing opening. It will have impacts on the women's shelter system as well. And so you will get an update on how those moves will occur once the Neville Street facility is available. And then after hearing from the Department of Health and Human Services and General Services, you'll have comments from our partners at the Montgomery County Coalition from the Homeless and Interfaith Works, and then it's open for discussion. As was mentioned, there is a second item that has to do with supplemental funding to make sure that we move the Neville Street facility along as needed. And with that, I would turn it over to Dr. Kroll and Mr. Dice to get you started.
Good morning. Thank you, Ms. McMillan, and thank you, council members, for bringing us together to talk about this Neville Street and housing and homelessness in Montgomery County. I want to say thank you to a whole lot of folks at this, but I'll do that as I make my brief comments to you all. Going back, just for context, since we closed Goody Drive, we have been in temporary quarters for shelter for this is going back to pre-COVID. 6 Taft Court. We did an expansion at Crabs Branch in partnership with DGS. 2 Taft Court, Rainbow and Progress Places, made some adjustments. And we've always used hotels to some extent to deal with some of the overflow issues that we faced. COVID added some intense complexity to this. The spacing needs got to be paramount importance. Our need to add hotels for our vulnerable population, our older adults, and for immune compromised folks grew tremendously under COVID, as did our need to do testing and vaccinating of folks. And at the same time, we were coming out of winter overflow, and the county executive, rightly so, I think, made a decision that we would continue year-round shelter for folks, that we would expand to year-round shelter. I think that had been a long-term desire for everyone, and this actually made life a little easier for us in some respects. That required, though, that we do some expansions, and we ended up having to expand into Long Branch and Cofield and the rec centers to make use of those spaces. I don't think anybody had a sense at the time how long this was going to be. We thought we were going to come out of this after that second wave, and history now tells us something different. And so we're at this point, I think. The good news around this is that there were enormous successes in this. Councilmember Glass, you talked about the positivity rate being so low, the infection rate being so low in the shelters. And that, I think, was in large part due to our partners very quickly learning that they needed to adapt, spacing out our residents and giving them enough space to move around safely with each other, compliance around masks, compliance around testing, and then later on compliance around work to get residents and staff vaccinated and keeping them safe while we kept the shelters open. It was an amazing tour de force, I think, for all those concerned. And I definitely want to express some appreciation for our partners in the community who really worked with us to make that happen. As we look at Neville Street, we're still operating under CDC guidance, and it looks to us that as if that guidance is going to be long-term. We've learned some things about health and wellness of folks that we're bringing into shelter. Coronavirus made it clear about the level of transmission of potentially infectious diseases that could be going on in shelters. And when you look at Neville Street, that has been factored into the design and operation and structure of Neville Street in terms of how we house, how people are roomed and given beds, and the ways in which the spacing is maintained, looking at the flow, looking at the health suites. It's a purpose-built shelter that I think is unlike anything we've had in Montgomery County, and it will serve us well into the future and hopefully well beyond COVID. The shelter is a wonderful outcome, and once we occupy it, it will be useful. But it is a part of our larger continuum of work to make sure that housing, that homelessness is rare, brief, and non-recurring, and that we are finding ways to keep people housed and to avoid even the prospect of becoming homeless, as well as helping folks to get out of shelter and get into permanent housing as quickly as possible. Amanda Harris and her team have done a phenomenal job of working across this continuum, and is continuing to work on seeking funding and seeking opportunities to expand our housing capacity. At the same time, we're trying to make sure that we have adequate shelter to house those folks who do end up homeless in our streets, and to keep them off of our streets. So thanks to DGS for all the work and the pace at which they have rushed to get Neville Street up and operational for us. They have been true partners in this process, along with MCCH and Interfaith Works, in helping us to think through what that space should look like and how we occupy it and how we will manage the bed space and capacity that is needed to serve our homeless and most vulnerable residents. So with that, I will thank you very much and turn it back over to Councilmember Glass.
Well, thank you very much, Director Kroll. Appreciate that update. Ms. McMillan, do we want to go to Ms. Harris and then our service providers? Is that what you'd envisioned here?
Yes.
Okay.
The update from HHS and DGS.
Excellent. Ms. Harris, do you have anything you'd like to add to Director Kroll's presentation?
Sure. Thank you, Councilmember Glass. Not much, no slide deck this morning, but thank you all. And I just think, although it's been really challenging the last 19 months or so, the collaboration between CEF, our nonprofit partners, the Department of General Services, has made it a much smoother process. And I think it's phenomenal that we're going to be able to open a brand new shelter facility in such a short amount of time. So thank you all for your hard work. I'm not going to spend a lot of time talking about where we've been. I think Councilmember Glass and Dr. Kroll did an excellent job of kind of laying the foundation of where we've come from, but I did want to spend just a few minutes about where we're going. So as Linda alluded to, once Neville Street Shelter opens, there will be some shifting around. So right now we are using 6 Taft Court and Crabs Branch to house men. And so we will be shifting all of the men to the 200-bed facility at Neville Street. The women will be split between 2 Taft Court and Crabs Branch. We are operating this year during the winter. Rainbow Shelter is open for women for overflow. They have the capacity of about 14 beds. So we are making use of them. And then Progress Place will remain open and available for both genders, so male and female. That's really important that we have that option, because we do have a number of couples that come into our continuum that don't want to be separated. So that's a really key component. So that's sort of where we're at over the winter, or in the event that we see a surge. We do still have hotels available, and so we can make use of those if we need to. We will be changing our hotel strategy a little bit. Previously, we had put people in one person per room. We will be doubling up this time, so 2 people per room, which still allows us to maintain social distancing. So that's sort of where we're at with shelter. We are seeing a bit of an increase on men seeking shelter. So we've been at full capacity there for a number of weeks, months. On the women's side, we're actually under capacity, which is great. But we are seeing a rise in men seeking shelter. So we've got a number of strategies in place to try and address that. You might remember back pretty early on in the pandemic, we talked about doing a centralized shelter intake and diversion process. So we have implemented that. And so we will continue to do that. It's not staffed as well as we would like it to be. We've been struggling with recruitment, but that does help to try and resolve someone's housing emergency before they actually end up in the homeless continuum. The other big piece is there's been a lot of investment from the feds around housing. Montgomery County received 118 emergency housing vouchers. So those actually went to the Housing Opportunities Commission, which is our public housing authority, but we will be using the majority of those to allow people to graduate from permanent supportive housing. So permanent supportive housing is the most intensive housing intervention that we can provide. We have a number of people that have been in that housing for 10 plus years that don't need those services any longer. So they will be moving on. They don't need services, but they still can't afford rent. So they will get the voucher, and that gives us the capacity to house another 100 people, very vulnerable people, into our permanent supportive housing. So again, kind of increasing the ebb and flow out of the shelter system. We have used a lot of the Emergency Solutions Grant to expand our rapid rehousing. We continue to do that. Over the last couple of months, we have actually offered incentives to both landlords and to people experiencing homelessness to take advantage of rapid rehousing, which has increased our rate, being able to move people in more quickly. I'm very excited about this. In January, we will actually open our medical respite facility. We have been talking about medical respite for at least 5 years since I started, but it is finally coming to fruition. It will be open, be located on Fleet Street, right behind the council building. So once we're ready to open, we're happy to host a tour of the facility. But that will they'll serve, I think, around 15 to 18 people, both men and women that are too sick to be really taken care of in a congregate facility, but don't need to be hospitalized. So again, that adds to our overall capacity. And then finally, we're continuing with some of our innovative housing programs that we did in the beginning of the pandemic, the exit bonus, which is direct cash assistance to people exiting shelter, and then the use of our COVID rent relief rapid resolution so we can pay a 6-month subsidy, no case management to help people quickly exit out of the homeless continuum. So that's all the good news. That's good news. There continues to be some challenges. We are seeing, and I'm sure that my partners at MCCH and Interfaith Works can talk about this in more detail, but we continue to see a lot of inappropriate discharges from hospitals, nursing homes, rehab facilities, residential behavioral health, mental health, or substance use programs. And at the same time as we're seeing more inappropriate discharges, the prevalence of behavioral health and somatic needs in our shelter is increasing. So we really need to focus on how do we move the work further upstream. Shelter is never a discharge plan. So how do we get to folks sooner so they're not ending up in our homeless continuum, where although we have lots of great services, we are not equipped to handle people that are in an actual crisis right now. Another challenge is just the lack of supply of housing units, and because of the rent relief and because there was eviction protections for so long, there just hasn't been as much movement or as much turnover in units. So even though we have vouchers in hand, it's been really hard to find units. And we're also seeing that rents are going up, and it's becoming harder and harder to find affordable housing, particularly for our folks that are using the rapid rehousing program. And then lastly, I'll end with this, the other challenge that we see coming in the future is that a lot of the way we've been able to address the needs, both COVID related and just in general of how to quickly move people into housing, has been making use of COVID related state and federal funds. So we used our state funds to increase our primary care medical services to people experiencing homelessness. We were actually able to provide psychiatric services, which we had not previously been doing in both our shelters and on street outreach. And all of that is funded with state funding that will go away in FY23. The Emergency Solutions Grant, our rapid rehousing, that is also scheduled to sunset in September of 22. So it's been working really well, and we're a little nervous about what happens when that funding dries up. And that's all I have. So thank you very much for your time.
Well, thank you very much, Ms. Harris. You hit on a number of important topics, and I think one that I think you alluded to, but I will accentuate is in the state and federal funds, the $100 million that we have been using for rental assistance to make sure that people do not become homeless during this crisis. And we've had lots of conversations about the speed at which we've been able to get that money out, but the process is working. And we have been able to keep people in their homes. So appreciate you and your vast team for being able to manage that. And then the last part I'll say before moving on here is the mental health component that you just referenced as well. This committee recently had two additional work sessions with other committees. Recently, the Education and Culture Committee with Chair Rice about mental health in schools. And then previously, we were part of a work session with Public Safety about mental health in the role of our public safety efforts. And so for you to bring this important issue up again and to talk about how our shelters are becoming another refuge for individuals who are experiencing some sorts of trauma is something I think that we should look into at a future conversation. So what we'll do, I'll introduce, we'll bring up Director Dice, and I see Mr. Asante on here as well. Then after that, we'll allow our providers to make some brief remarks, and then my colleagues have already asked me to start the Q&A. So if we can go through that, then we'll get into a robust conversation, I'm sure. So Director Dice.
Well, thank you, Councilmember Glass. My comments won't be very long since you and Dr. Crowell and Ms. Harris have done an excellent job describing the new Neville Street site. And I guess what I'll first say is that you can visit our neighborhood projects page and get an update and keep an update on the progress of that project. It is going very well. Walls are up. Fire sprinkler system is installed. Ductwork is being installed. And we're very confident that we will meet our goal to complete this structure by the end of the year, at which point we will work with HHS and the providers to relocate this population to the new shelter and restore the existing rec centers to their rec center status. We're very pleased with the way we've gotten great cooperation from other county departments, permitting services, and the others, and worked very closely with the service providers. I see Ms. Sinclair Smith is with us, and Ms. Schiller, and we routinely work with them as we're going along to make sure that all the necessary features to this facility, from the bedding to the security systems and the like, are all ready to go for an immediate occupancy. Really don't need to say much more than that. We're pleased to see things going as quickly as they are, though that was our commitment, and we're confident that we'll keep it.
Well, thank you for that. I was thoroughly impressed when I did the tour a few weeks ago to see the state of that facility, and for you to share the timeline moving forward. And so appreciate the speed and the commitment that you have made and your teams have made to getting that open as soon as possible, and look forward to returning when it is officially open. And the folks that will be moving into that facility, let's turn it over to Montgomery County Coalition for the Homeless. I see Ms. Sinclair Smith and Ms. Schiller here. Do either of you have any brief comments you want to make about the shelter, about preparations for the shelter, or anything else you want to share with us?
Yes, thank you, Councilmember Glass, and thank you for inviting us here today. We are, as I think you know, we are absolutely thrilled to be at this point. And when I look at all the boxes on our Zoom meeting, I just want to thank each and every one of you for being part of supporting us to get to this place. It is really, it's going to transform our system. I do want to put a face on who we're talking about, especially from the men's shelter. We are talking about the most vulnerable residents of Montgomery County who have encountered significant challenges. People do not fall into the experience of homelessness immediately. They fall into the experience of homelessness after they've worn out their family and friends. Majority of the people we are serving now are Montgomery County residents. If someone's not from Montgomery County, we help them return. So I do want to, as you know, 19% of the residents of Montgomery County are African American. Over about 75% of the population we serve in the emergency shelter program are African American. When you combine that with brown and mixed race populations, we are up to 80%. So these are the most vulnerable residents, and also people who have experienced discrimination in housing historically. It just is overjoying for me that we're talking about the role of emergency shelter as part of the homeless assistance system. Emergency shelter saves lives. It's also a critical link to help people meet their urgent needs, but then move on to permanent housing as quickly as possible. And we have a 30, 60, 90-day move out strategy. So we're not just talking about a building, we're talking about a critical link and cog in the wheel and an effective approach. As everyone said, it has been changing, dramatically changing. We have moved from 60 full-time 24/7 beds to 200 now in response to COVID. And also I think there was a recognition by both the executive and the council that the system we had before, people went into DC during the summer months and come back, and it was hard to provide ongoing services to that population, and we prioritized who people could stay. We have been meeting the increased demands of the COVID pandemic. That's why we've expanded into operating our program in 3 locations and motels. We have been driving from location to location. Our operations managers, our case managers, our food, our donations to these different locations. So you can imagine for us what this will mean to have everything in one location. We have been homeless ourselves for over 2 years, and our driving force has been to we have a deep passion for the work that we do, but we've been able to continue to provide a range of services that our men need. We have become nimble and flexible, and we know, okay, we've got to move now. We've got to do this. We've got to protect our staff. We've got to protect the men that we help. So we've developed a lot of skills, and we've really appreciated the partnership with HHS, the executive branch, with the council during this. Just to let you know, this building is going to be transformational. We are co-locating all our services in one location. You'll hear from Jen Schiller quickly. I'll be finished quickly so you can hear from her. But we have behavioral health services that we've actually been funding privately and we've had on site. And it's great that we're going to have increased behavioral health services. We have medical services. We have our employment back to work program. We have a housing locator. We have a rapid exit specialist who helps men who can move out of the shelter quickly. We have a harm reduction peer support specialist, given the increase in overdoses and deaths that we're seeing from the combination of mental health and substance use. And now that we've had these housing resources that Amanda mentioned, and realized how essential our partnership is for both the government and to us in terms of getting these COVID relief funds out. We have moved more than 200 men into permanent housing over the past year because these resources have been nimble and they have met the needs of a range of different men. We do know, and you'll hear from Jen, the awesome partnership we've had from day one, and in terms of designing this location. We know we're opening on January 1. We know we're not going to have, we just found out we're not going to have the furniture for 3 months. We know that DGS is facing supply shortages, but we're moving in and we're going to make do. And we have other supplies that we can bring to bear to meet our needs, but we are ready to move in on January 1. We just can't thank you enough for this commitment and partnership. And it's going to be transformational and for Montgomery County, and we're going to be very proud. So I'd like to quickly turn it over to Jen Schiller, Montgomery County Coalition for the Homeless Chief Programs Officer, who also one of her geniuses is operations, which you'll hear from.
Sure, Ms. Schiller.
Okay, great. Hi, everyone. Thank you. Excited to be here today. And really, I just have a couple of things to mention. The first one is just, it has been so awesome to work with DGS, their team, Greg, Hamid, Rasa, Miriam, David. It's been a really exciting time, and also working with the HHS team on this as well. They really listened to our 30 plus years of experience running emergency shelter. Everything from how do you want the lights to go on and off, to building security, to the flow, to the queue of the dining room, and everything in between. And I don't know if you guys have been to the Upper Cordoza Health Clinic in DC, but if you go to that health clinic, what I love about it is when you walk in, you don't need to speak English to figure out where things are in the building. And when I was explaining this to the DGS, the engineers and all these folks that were in the room that I'd never met before, they were really curious about that. And so we're like, wow, well, tell us more about what this would look like and how this building feels to somebody when they get in there. And this is how the shelter is going to be. So when you walk into this new facility, there are going to be these big keys at the front on the different levels, and they're going to have pictures, and those pictures are going to be associated with colors. And so when you walk in, you can find the dining room, you can find the sleeping quarters, you can find all sorts of things without needing English to get around the building. And I think that is very innovative and just a really exciting feature. There'll also be smaller rooms and pods to house people if they, are a vulnerable population or feel uncomfortable mixing with, the larger group that will be there. It's been a really wonderful experience. We know that the move is going to be stressful initially. We know that some of the things won't be in place, so we'll have some temporary things there, but we will absolutely be ready to go. Like Susie had mentioned, we have learned how to be incredibly nimble and very adaptive. We've been at Long Branch. We've been in lots of different places temporarily, so we know how to do that. We know how to move quickly. We know how to get things up and running. But this new facility is going to transform the way that we're able to provide services. It's going to be an outstanding facility. When you look up, I love the tall ceilings. I love the fact that the HVAC system is just going to suck air through that building so fast. It's going to make your head spin. It's going to be wonderful. It's going to be amazing. It's going to be something that Montgomery County is really going to be proud of. And I think when you all go there and see these services and see how quickly people are able to move in and move out of this shelter, and in a lot because of the physical design of the building and the way that these pods and areas are set up, and it's set up for social distancing, and it's set up so that our case managers, when they turn their chairs around, in the old shelter, you'd turn your chair around and you'd hit each other. Actually, you couldn't all be in there at the same time. Now there's space to actually do the work that we need to do, and it's just so very exciting. So I'm looking forward to being a part of this state-of-the-art facility, and really from the bottom of my heart, thank you all. And on behalf of all the clients that we serve and all of our staff, we are incredibly grateful, and we will do amazing work, and we will end homelessness, and this facility will be a huge part of that. So thank you.
Well, thank you, Ms. Schiller and Ms. Sinclair Smith for that update. And what makes me happy about that update is that both of you are really happy about the process. And I remember when we took up the appropriation for this project, we all collectively implored DGS and the county to listen to our providers and work with them, and that seems to have been done in fantastic fashion. So really, I commend everybody, especially DGS, for that collaboration and for listening to our providers who've been doing this work for 30 years, as Ms. Schiller said. And the irony, of course, not lost on anybody, that MCCH has been homeless and without a permanent central office for the duration of this period, and the work that you've been able to accomplish is nothing short of extraordinary. So thank you and your teams. And then the other partner, which is integral to this conversation as well, is Interfaith Works. And I see Mr. Hall and Ms. Hung here. And Mr. Hall, if you'd like to give us an update on the work and the facilities that you all have been managing.
Great. Thanks, Councilmember Glass, and good morning to everyone. And thank you for inviting us here to participate in this discussion, in this work session. We, during this pandemic, have just been very thankful for the partnership of CEF, of DGS, certainly working together with our partners MCCH, and also Rainbow Place. For the partnership in ensuring that we collectively can provide the emergency shelter that's needed to those who are in need. Of course, at Interfaith Works, we continue to support Montgomery County's goal of ensuring that the experience of homelessness is rare, is brief, and non-recurring. And I think that in many ways has been realized even in the midst of the pandemic. We have sheltered Interfaith Works 805 individuals since the start of the pandemic. And we know that based on the work that our very skilled team has done, certainly again in partnership with the CEF team, we've really saved lives during the pandemic. The way that shelters have been expanded, ensuring that people aren't forced to leave during the day, the increased social distancing in the shelters, certainly taking on the expansion to new facilities as required and as was necessary, have all contributed to the very low incidence of COVID positivity, which has already been mentioned earlier in the conversation today. And I think that's something that we really all should be very, very proud of. In some ways, because we hear it so much and because we're so privileged to live and work in Montgomery County, I think we can take it for granted. Many jurisdictions have dealt with significant outbreaks and we have not. And that certainly has been very intentional. I did want to just give an overview of our shelter capacities, certainly currently where we are now and where we expect to be. So right now, as you may know, there is some construction happening on the 3rd floor at Progress Place. When that construction is complete, that will add 13 additional spaces for a total of 56 at Progress Place, which we're really excited and happy to have happen. At the Women's Center, we continue to have a capacity of 35, and at Crabs Branch, once we move, there will be a capacity there for 35 women also. And that will give us a total of 126 for women and at Progress Places necessary for men who are experiencing homelessness. As was mentioned previously, the overflow shelter at Progress Place is very important because it's co-ed, and there are many couples who come in who wish not to be separated, and in some cases that is their sort of determining factor about whether or not they'll seek shelter. So this is a really important component of the system, and we're happy that we have those spaces that can accommodate that need. I did want to highlight a couple of things. One, we are hoping, fingers crossed, and very encouraged to hear the report from DGS that the Neville Road shelter will be finished in time. So we are set, hopefully, to move to Crabs Branch sometime in January, perhaps the beginning of February, hopefully as soon as possible. We have been working with DGS, and we hope to continue to work with DGS very closely to make sure that the facility issues that have been identified at Crabs Branch are fixed so that by the time we move in, the women and our staff can have a decent place to live and to work while we continue doing the good work that we're doing. I did want to also just say a note about mental illness, the incidence of mental illness. So the PIC count showed a 27% increase in severe mental illness between last year and this year. We think that in many cases, that's because we serve as a low barrier shelter, which means that we do everything we can not to turn people away from seeking shelter. Obviously, that means that when people are inappropriately discharged from the hospital system or the behavioral health or can't get access to behavioral health care, they are often brought to the shelter, and we do our very best to serve them. We have seen an increase in incidents. We, across our shelters, are seeing an average of 1 to 2 incidents per day, which is significant. And what we found is that about 20% of those have involved violence or threatening behavior. We are, again, grateful for the partnership with local law enforcement, although our staff are very skilled and very good at de-escalating incidents, and many times do not have to involve law enforcement, which is actually what we prefer. We are able, on occasion, to engage the crisis center. We would like to see more of that. We would also like to see more from the behavioral health side around the sort of support and access that clients can have to behavioral health services so that they can be able to seek safe shelter when it's necessary and appropriate, and also be able to seek inpatient behavioral health care when it's necessary also. So we continue to work to make sure that our shelters are a safe place where people can seek shelter, an appropriate shelter, and be served appropriately. And we're asking, I think, this committee to sort of continue working with us, the HHS team, Dr. Crowell and his team, to continue working with the shelter system so that we can assure that all clients who we're serving receive the appropriate amount of care. I'll turn it over now to Christine Hong, our Director of Homeless Services, and, for her to add a bit more. Thank you.
Thanks, Courtney. I also want to thank this collaboration. It's really been an amazing past year and a half, and I think we couldn't have gotten through it without the support of one another. And you know, as much as we are proud that we are low barrier at our emergency shelters, it is a challenge. And so we often found ourselves transferring clients, you know, who may have had an incident at one shelter that was upsetting or traumatic to clients or staff to another shelter. And we found that to be very effective. And so it truly is a collaboration. I also want to thank DGS for helping us address some of the facility needs that came up at Cofield. Nearly all of them are completely resolved, and that is because the team with DGS really came together and addressed those issues quickly. So want to give a shout out to that team and thank you for that. I also wanted to highlight the importance of the space at Progress Place. It is the only co-ed facility at the emergency shelter level for both men and women. This has been said several times, but it is also important because the 5 spaces there that are used to shelter men and women are flexible. And so if at any point we reach capacity at either our men's facility or our women's facilities, we can change the rooms, the setup at Progress Place so that we can accommodate either more men or more women. So it's a very important space for that reason, in addition to being able to shelter couples. And so I just wanted to bring attention to some of the facility needs there. I know that DGS and CEF are working on completing the 3rd floor of Progress Place so that it can be used to shelter the additional number of people in need of shelter, so that the full number at Progress Place would be 56. Currently, the plans are for there to be 2 private restrooms on that floor. We would request that there be an additional restroom as well as changing rooms so that people can change in private. I know these details can be worked out together, but I just wanted to highlight some of those needs to make the space optimal and functional and safe. And in addition to that, there are some other details related to the Crabs Branch facility that just need to be adjusted so that that space as well is safe and secure for when we move there, hopefully in January. But yeah, really wanted to bring up these needs and to thank the collaboration here for all the ways that we've been able to make it through this pandemic and will continue to do so collaboratively.
Well, thank you very much, Ms. Hong and Mr. Hall for sharing with us where you and your teams are as well. Mr. Hall, you also re-upped the mental health component and shed some light as to how you and your teams manage that. So again, I think really important that we continue that conversation here, and whether we do so with another committee, the council can figure that out. But thank you for opening our eyes even further. And Ms. Hong, your comments about the enhancements at Progress Place, while we are well aware of the work that's been needed, it is because of that work and the need for that work that we in DGS was fully prepared for this new Neville Street, and recognizing the increased demand and wear and tear that would be put on the facility. And Director Dice is nodding his head. And so we are building this new facility with lessons learned, which is always a good thing in government. Right. And so, well, Susie, if we can just hold on real quick. All of my colleagues want to speak, and I'm pleased that Council President Hucker is joining us for this conversation as well. I have a series of questions, but first let me turn it over to Vice President Albernaz, Chair of the committee, to start the conversation.
Well, thank you, Councilmember Glass. Great job facilitating this discussion, which is clearly overwhelmingly positive, especially considering where we've been and the journey we've all been on together. It really is extraordinary to see the foundation and infrastructure that we have here that is working so well. I'll just make a couple of observations, ask two questions, and then ask to be put back in the queue, Councilmember Glass, so that we can get to everyone. And I know Council President Hucker has a meeting in a little bit, and I know there's some questions that he wants to ask. Just in terms of some observations, and I appreciated Mr. Hall talking about the increase in mental illness and behavioral health challenges. I think that the 27%, that tracks almost exactly with the uptick in emergency rooms in a briefing that we received last week. I mean, almost exactly. I think theirs was around 30%. And they also reported some additional incidents of violence. And so they've had to provide additional security in emergency rooms. And I really appreciate the emphasis on de-escalation, but acknowledging that for the safety and security of the staff, the personnel, and the patients and clients themselves, there has to be sort of a synergistic plan in place, as there is. But I'm also, it raises the other issue. I'm concerned about your staff, your teams, who are overwhelmed and exhausted. And you add to that the layer of complexities of these cases, which can be scary at times. And I know we're having recruitment and retention issues in front-facing social service organizations across the board. So if we could talk a little bit about, not necessarily in this session, but let's put a pin on this and talk about some of the best practices within your respective organizations, maybe what's out there in the field. Dr. Kroll and I have had many conversations about this. He's been very much upfront and a leader in trying to ensure that there is support for personnel, because we just can't continue to absorb the amount of people that are leaving the field because they're not being replaced by folks in a manner that's sustainable. And we're not even talking about cultural competency. We're just talking about, triaging the current situation we have. So I would like to, at some later time, talk about what some of those best practices are, and if necessary, resource those best practices so that we can better support our frontline personnel, particularly through these challenging times. The other thing I do want to ask, though, and I'll start with Ms. Harris on this one. I was really impressed with, 2 years ago, we boldly identified eliminating family homelessness as the next phase of our important work, coming on the heels of the successful efforts to address veterans homelessness. And it does sound like we're seeing some trends in terms of men and individuals, but how are we with families? I know that it's a challenge because, providing the safe level of space and accommodations to families is not something that is simple. But could we talk a little bit about that capacity, Ms. Harris, and what we're doing to address that both in the short, medium, and maybe long term?
Sure, I'm happy to answer that. So overall, we're doing okay with family homelessness. We had during the last point in time, we actually had the lowest number of families that we've ever seen in our homeless continuum. I think that number was around, I don't remember exactly, but in the 20s. And that continued. We continued to have a low number of families entering our homeless system, and we were able to very quickly connect those that were into permanent housing. So our outflow was exceeding our inflow. I will say, beginning around July, August, we did start to see an uptick in the number of families seeking shelter. We're trying to understand why that is, because that was also coincidentally the same time that we started to really ramp up the COVID rent relief to try and meet the 65% spending target for our ERAP. The same staff that do the intake for families were pulled away to focus all their attention on eviction prevention. So we're digging into that a little bit more to understand and trying to figure out how we can get back to normal business and be able to spend the time needed to divert families from entering the homeless continuum. Because you would think with all this money available for rent relief that we wouldn't have the same increase in families. So right now we're hovering about pre-pandemic levels, so around between 50 and 55 families. We have adequate resources to house them. So we have plenty of rapid rehousing slots. We have some permanent supportive housing slots because of the families that are moving up and going to the emergency housing vouchers. But it's been difficult to find places to rent, like I mentioned before, just a lack of supply, and especially for larger units, easier to find efficiencies in 1-bedrooms, but 2- and 3-bedroom units were always a challenge, but even more so now.
Thank you. I appreciate that. I will yield back to you, Councilmember Glass, and allow other colleagues to ask questions. But if you can put me back in the queue, I'll ask some questions at the end. Thanks.
You are back in the queue. Councilmember Rice, you're next.
Well, thank you very much, Councilmember Glass. Really appreciate that. And I want to start off by saying thank you to you and your team, as well as to all of the leaders in our opportunity to end homelessness population, all of our nonprofit partners for their partnership. It was a little while ago that I introduced a bill really focusing on trying to keep our community safe, those who were experiencing homelessness. And it was together through collaboration that we decided to go in a different direction of how we would help to support those individuals who are experiencing homelessness and really ensure that they have a track that allows them to solidify getting back on their feet. And so part of that was through income and making sure that folks can garner the income that's necessary, especially in a time like this. And I really want to thank everyone for their thoughtful ways in which they gave proposals on how to focus on economic development and workforce development as a whole for individuals, understanding that the reality is no one should have to ask for a handout. We should be making sure that folks have all the resources necessary to be able to be gainfully employed and successfully be able to put money in their pocket, food on their tables, and to be able to afford a place to live here in Montgomery County. And that is sufficiency. And that is truly what we're trying to make sure that we achieve for everyone. And so just wanted to start off by just saying thank you. More to come on that. And thank you, Councilmember Glass, again, for your partnership in working with me on this, and then all of the leaders as well, from MCCH to Interfaith Works to Bethesda Green to DHHS in general. All of you have just been incredible in terms of every mind, all working together to make sure that we can come together to come up with something that we think will be very radical in what it is that we're trying to do, but incredibly successful in an outcome. I did want to ask one question. It's just on the status, Mr. Dice. We had talked about the facility itself and how we wanted this to look different, how we wanted it to have, especially on the outside in partnership with our Montgomery County Coalition, or excuse me, our Commission on Arts and Humanities. And I know that Susan Jenkins had certainly volunteered her services, had talked with Ms. Sinclair Smith about some of the things that we'd like to see about this being an inviting and a welcoming place. Talk to me about the design. I know that part of this is going to come up when we talk about our next steps in terms of the shelter itself, but did just want to get an understanding of where we are from that perspective.
Yeah, I appreciate that. We did talk about that. That will be phase 2, if you will, where our focus is understandably to expend all of our available and limited resources in getting this facility done and open. Phase 2 will include some site work, the exterior work, also construction of a gazebo in the back. We're coming back, but right now our focus is on getting the facility completed and open.
Excellent. Well, I appreciate that. I just know that, again, as we look to, and it's what we did with a number of the buildings that we acquired as a county, which Mr. Dice and Mr. Asant, you know all too well. And we really wanted the look. When I look to downtown Bethesda and I see what downtown Bethesda looks like, it looks like any other apartment building that's there. No one would know that this is an apartment building. It's actually dedicated to people who are experiencing homelessness. We want the same thing to apply in this building, and for us to make sure that this is not the standout in the area that people can point to and say, oh, and that's the shelter. We want this to be a welcoming, inclusive place, something that shines as a beacon of hope and what we're looking to do for the future when it comes to these individuals. And so just as we're redesigning our schools, just as we're redesigning a lot of government buildings, I know that the same work is going into what's happening here at this shelter, and just really want to say thank you for your continued partnership and approach to that. That is tremendous. And my last question, Mr. Glass, because I said I had to, is just about from COVID protocols, and I guess this goes to Dr. Kroll and to staff, as we are looking at trying to manage, because we are going into flu season, where are we when it comes to vaccinations for the regular flu itself? Are we doing those in concert together with offering vaccinations to folks for COVID? How is that process going to work? And do we have the staffing and the materials, vaccines that are necessary to make sure that we can deliver that to this vulnerable population?
I think Amanda can talk to you about the schedule around that, but we are continuing to offer vaccinations for COVID to our residents as they come into the building, and encourage them to get vaccinated. There is no shortage of supply for vaccines for adults, so we are fine. And there's a schedule at which people come through, our healthcare folks come through to offer vaccinations. I believe we are also, as part of that, offering flu vaccination to folks as well, so that they can get it while they're there in the shelter. So, Amanda, I want to make sure, looking at you to make sure I got that correct, and you can give us some more detail.
Sure. Thank you, Dr. Kroll. That is correct. I'm just confirming how often we're doing the flu vaccine. I know that we have always offered flu vaccine for folks living in congregate facilities. We continue to offer the COVID-19 vaccine twice a month at our 4 largest facilities. We started out with a very low vaccination rate. It was less than 10%. We're currently around 40% in our facilities. So it's getting better, not where we want it to be, but getting better. We have been offering some incentives. We're doing a vaccine lottery at every clinic. That has certainly worked. If not for people to get their vaccine on site, but to show us their card that they actually were vaccinated elsewhere. So having access to that information is really important. We are going to be talking with our nonprofit partners and our partners in public health about boosters. Many of the folks in shelter received the Johnson & Johnson vaccine because it was 1 dose and it was easier. And they are eligible now for a booster because that's only after 2 months. So trying to plan for how we roll that out. But we have a team of nurses and medical staff that come out and do vaccinations and testing.
So what I would just ask is this, Dr. Kroll, and I know that you and Ms. Harris know how to make this happen, just based on the success that we've seen in the greater community as a whole. But I do think that we need to make this a priority, and so maybe increase the amount of days and availability. I know that even though the acceptance rate may not be as high, and so it seems as though we're kind of chasing the tail as we go around, I think it's incredibly important for us to just make sure that we're offering it continuously, especially just based on how vulnerable these individuals are, how they may rotate from in and out of the shelter onto the streets. It's just really imperative. And I always just think about, the sort of identification of the two, and how it's going to be even more challenging for those who are experiencing homelessness versus a person who may have access to high quality healthcare and a primary care physician and the whole 9 yards. And so from that perspective, misidentifying one versus the other and thinking that they just have the flu versus COVID, all those kinds of things. So the more that we can do to just try and make sure that that availability is there. I know that for our partners, they're looking to make sure that they can have this offered to their clients. And so if we can try and do a little bit more in terms of scheduling, and if it will require public-private partnerships to help enhance that as well. I know that we've done some great things with Aetna, CVS, and other members in the community as well. So let us know how we can help. We certainly want to be a partner with you. It's not that you haven't done the work and the effort, you certainly have, but we want to continue to try and increase that, just as we've asked in the greater community that we continue to increase those opportunities. We want to make sure we're increasing those opportunities with our people that are experiencing homelessness as well. So appreciate your partnership. And thank you. Thank you, Mr. Chair. Back to you.
Well, thank you very much, Councilmember Rice, and appreciate you asking about the flu shots as well. Very timely and seasonal, and glad to hear that those are available. And then with regard to the collaboration and everybody on this Zoom, we want to make sure that we have as strong a social safety net as possible. And that means that everybody has to grab a piece of that rope. And you see many of our partners here, not exclusive, but many of our partners here who are holding tightly onto that rope. And now I will turn it over to Council President Hucker, who I appreciate joining us and has had a keen interest in this topic, making sure that everybody is housed and that communities can resume life as we return to normal. So, President Hucker.
Thank you, Council Lead Glass, and all of you for joining in this. This is a really great and much needed conversation. Thanks to you and the HHS chair for scheduling it. I very much appreciate all the work everyone's doing. I'm really excited about the movement to year-round shelter, which many of us have advocated for years. That is terrific. It's really groundbreaking, and I appreciate that we're moving as quickly as possible to open the Neville Streets shelter on time. And Ms. Hong, thanks for all your good work, and Mr. Halls as well. I'm very happy to hear about the enhancements at Progress Place and the lessons that are being learned there that will be implemented at Neville Street. I certainly appreciate that no one here planned on the situation that led the executive branch to use the 2 rec centers in my district for temporary housing. And everyone here, I think, knows I have some concerns about the decision to continue their use. In retrospect, I hope we can agree that repurposing rec centers in particular for housing doesn't make sense on an ongoing basis, and that it should always be done with a vigorous, public, transparent process, an alternatives analysis, a racial equity analysis. But to me, they're not the first place to turn, since they're not up to our legal standards that we set for housing, the county housing code. And so I know all of us care about our vulnerable clients. Putting them in any building that is not up to code is not really fair to them, and I think it's impossible to justify. And I say that it's impossible to explain to the public why we would shut down an apartment or a hotel with similar conditions and violations as we have in some of our rec centers, mold, mildew, hot water, but we allow it on an ongoing basis for our clients experiencing homelessness. We can't explain that double standard to people. It makes no sense. So that's not at all the responsibility of our terrific nonprofit partners. That is on us. That's on the county. I was there the night that the Flower Branch apartments blew up. We discussed moving everyone to Blair High School overnight, and then it was suggested to use the Long Branch shelter on the night the Flower Branch apartments, because it was a few blocks away. It doesn't make sense to conduct that practice for over a year when there's so many other housing alternatives. And it makes even less sense when we choose shelters in two underserved areas with many residents in Long Branch and Littonsville without cars, and really with the least recreational alternatives, including no private gyms or health clubs in those neighborhoods. And we know there are alternatives. We were told there were no alternatives, but my staff and I worked with Visit Montgomery and others who offered multiple alternatives within 24 hours that are up to our legal code. They're designed for housing. They have adequate hot water. They don't have mold and mildew and mice. And they're respectful of unhoused clients' need for privacy and dignity more than cots on gym floors, especially when those clients need to be bused once a week to showers off-site, which was very sad to learn about. So I don't want to relitigate this. I'm done talking about it, but moving forward, I think it's on us, the council, to have the county government, to have always a plan in place and clear specific policy for the emergency use of any shelters, any community centers. Policies that place a limit on the time that facilities can be repurposed as temporary housing or other emergency services. So I guess I have a suggestion and a question. One is, the council vice president mentioned best practices. Best practices don't just apply to our nonprofit partners, they apply to government as well. In the future, I think the council should set standards for the use of temporary housing in a time of emergency. Flower Branch made sense. This may have made sense when everywhere in the county was closed. I don't think it makes sense over a year later. I think we should define the meaning of the word temporary, since it's not understood by the public to be over a year, and we should clarify what the selection process is and the public engagement requirements, since we've never been able to defend the lack of public engagement and process in this effort. The neighbors in Long Branch and Littonsville have been very, very patient, but I can tell you they are very frustrated that their rec centers were commandeered this way when there are so many alternatives. The clients are also not happy. They're happy to have a roof over their heads, but they don't understand how government works. They are terrified to speak out, but I've spoken to so many of them that are very, very frustrated as well. And many of them are fleeing domestic violence, and they feel like their injuries have been exacerbated because they now feel marginalized and ignored by their own county government. I realize we're not going to do anything differently until Neville Street opens, but I really hope we can work together collaboratively to avoid a situation like this in the future. That's my suggestion, that the council should set standards for the, quote unquote, temporary use in emergency situations of public facilities, and the process to use the private facilities that are available. And then my question is there a report available, maybe Ms. McMillan, detailing how we're using federal relief funding to shelter our unhoused residents and how we compare to other jurisdictions? I know other counties have used this funding to create new programming, to build shelters, to create additional housing, including deeply affordable housing. I know we've spent well over $100 million, on hazard pay and other things that other counties had not spent their funding on. I really think moving forward, we should look at what other jurisdictions are doing to use their federal funding to mitigate the burden on our clients experiencing homelessness in the future. And we should partner with our great nonprofit partners here to create a strong recruitment pipeline for social workers as well, which I know we are struggling to have enough both here and in our schools. So that's my suggestion and my question. Could we get is there any report? And if not, could we get a chart comparing how we use our federal relief funding compared to other jurisdictions?
We can pull together what the county has used its funding for. You've received some of that in previous briefings, but we'll pull that together and see what we can get.
Yeah. I had heard from other jurisdictions that it had changed recently, but it would be great to get an update on that. Thank you. Anyway, that's anybody else can comment. I don't want to take it away from the chair, but thanks for letting me join you this morning.
Thank you very much, President Hucker. And I personally appreciate your work on this, right? Trying to strike a balance between making sure that everybody has a roof over their head and that some of our most underserved communities have an outlet to congregate, to recreate, and to resume life as we're able right now. So thank you for your efforts there. I know that Vice President Albornoz is back in the queue, but let me just ask one or two questions of my own that have not yet been asked. The concerns and the day-to-day problems that our providers have talked about regarding mental health and the needs that they deal with every day. I'm curious how the new Neville Street facility will be set up. And, as we look at the 200 beds and as I had walked through and saw the designs for the rooms and the floors, I'm curious if any of those needs and the mental health needs are going to be included in this project, if there's any certain services or quarters, so to speak, for anybody experiencing any trauma or something else. I don't know who I would direct that to.
I think Jen Schiller might be a good.
Would you like me to
From NCCH's perspective? Absolutely. Sure, Ms. Schiller.
Okay, sure. So I think the fact that hallways, waiting spaces, all of those things are wider, bigger, longer, easier to access. There are a lot of, before we would get requests for things like, I need a quiet place to think, I need a prayer room, I need this or that. So there are smaller spaces that are designed for that. And there are also a few smaller rooms that we would call pods, where there will be beds with doors and whatnot that close for individuals if they cannot be in the larger space. But also the larger bed areas have these half walls. They're 10 foot. I think they're 10 foot, right, Dave? I don't exactly remember, but they're even in the spaces where you have a lot of like dorm style sleeping. There are also walls that separate people. So I'm not sure if you guys have seen yet the like the layout of the space, but even if you're in a larger dorm, I think Councilmember Hucker, you had mentioned, just a bunch of cots on the floor. It's not like that, even though you're in a facility that has 200 beds. The beds are also split up on different levels, and there are also these kind of like false walls that have charging stations and whatnot. So so there's both. There's both the larger sleeping spaces, but then there'll be smaller sleeping spaces. And then I think the way the hallways and the way that all of there are smaller areas where they can play games. There are game rooms and things that didn't exist before in the other facilities. There's also counseling rooms that didn't exist in the other spaces. So there's definitely a lot of thought went into that, as well as the color scheme, both of furniture and of the colors of the walls and things like that, so that things aren't triggering, and in fact are much more muted, and it'll be a nicer place to be in. And I think the flow of the building, the design of the building, the lighting in the building, the subtleties with which you can change the lighting, all of those things will help kind of with de-escalation and helping with individuals who are
Also the
experiencing
security
mental health
system.
problems.
You want to mention that security system? Because I think that.
Right. And so the security system is going to be absolutely outstanding. It's designed very much like at the crisis center. There'll also be a PA system. There are panic buttons everywhere. Panic buttons, not only staff can access them, but also other clients could access them if they were in a space where, they didn't feel safe. There's these big red buttons on the side. So there's a lot of design features as well. If there was, for example, an exposed beam that somebody could bonk into or something that's all padded and nice. And so I think that there's been a lot of thought that went into the design. The same thing with the windows and letting in natural light throughout the entire building. That was a huge part of the design, because you are dealing with, I don't remember how many, 20,000 square feet. It's a big, huge box on 2 levels. So there was a question about how can we make sure that light can get through the entire building to help with everyone's mental health. And so that has been a big part of the design as well. And the same thing with airflow and making sure that the space, that you don't feel like you're you're stuck in a very small space with people. It's one of the reasons why when you look up, you don't see a ceiling doesn't hit you in the head. So you it just kind of, it's one of those false ceilings, just goes up, up, up. And I think all of those things will help with everyone, but especially with people who are experiencing serious and persistent mental illness, who might be, perhaps more violent in a large facility. Having those smaller spaces where people can sleep or people can decompress will be very important. And it's been an important part of the design of the building.
Sure. Well, I appreciate that. And, in addition to the security and understanding how that works, the aesthetics and making sure that people feel calmer and, from the airflow and the light to the colors to some of the other design functions, it sounds like all of that has been incorporated. And so I appreciate you sharing that with me. The other question I have before I turn it over to colleagues who have additional questions. Earlier this year, in June, during Pride Month, I hosted a conversation about LGBTQ plus youth who are homeless. And LGBTQ plus youth, while making up a small percentage of the general population, or 40% of those who are experiencing homelessness because they don't feel safe at home, they've been kicked out of home, or for other reasons. And I was curious how the Neville Street facility will incorporate youth, particularly those 18 to 25 who might not be able to commingle with the rest of the population that's there. Ms. Schiller or Sinclair Smith, or even Ms.
I think Ms. Schiller will be best to answer that question. Thanks.
Absolutely, I'd be happy to. And thank you, Councilmember Glass. I did just want to say there are more than 2 genders. So I know that we keep talking about men and women, and there are a whole spectrum of genders. So just want to note that. So our facility is designated for men and individuals who identify as male, who live in Montgomery County. And I do think it's again those pods or those smaller spaces that will have beds if individuals who come to our facility do not feel like they are able to be in with a larger, the larger group of people that are there, that they would be given a bed in one of the smaller spaces. And those are intentional, could be, they're flexible spaces. So, and there's more than one, so they could be designed for youth experiencing homelessness, as well as someone who's experiencing a mental health crisis. So they could be flexible with who is in those spaces at those times.
Absolutely. And having that flex space also goes back to that previous question I asked about, anyone experiencing a mental health episode as well, to be able to put them there. So glad to know that there is an abundance of space that can be, used for a variety of functions. So again, really, really good job to you and DGS and everybody about the design so that it can meet the needs of the time and of the folks that are there. I know that Council Vice President and Chair Albornoz, you are now back at top of the queue. It's all yours.
Oh, thank you. I appreciate it. Several of you alluded to, understandably, the transition that's going to have to happen during our cold months, which is, the height of the season in many ways. Some of the previous transitions, I guess, maybe serendipitously happened when weather was warmer. And it's incredible, the nimbleness that the team has been able to establish in getting folks through. But could we talk a little bit more about that transition period over the next couple of months, and what, if anything, you need in the way of additional support it's going to be challenging no matter what, but to ease that transition as much as possible?
So if I could, I'll just sort of circle back to one of the points we were discussing regarding overflow. So there's some construction happening on the 3rd floor. And this is not directly related necessarily to cold weather, but one of the needs that we have is some additional space for changing rooms. So we are constructing some private restrooms for the 3rd floor, where both men and women will be housed. But as you'd imagine, with a private restroom, that doesn't provide quite a bit of space for people to actually change, or they can only be occupied one at a time. I'd like to, if I could, kind of pitch it to Christine, who can give some additional details, but I did want to highlight that as one of the ongoing concerns that we have, that we've mentioned to DGS, and I know that they are considering how we can make that happen, but perhaps it might be also useful to have some of that discussion here, or at least sort of put it in the parking lot for now. So Christine, if you have a few points you could mention about that, please.
Yeah, so the third floor is how we expanded and safely socially distanced all of the men and women who are at IW Overflow at Progress Place. And the third floor can expand to accommodate a total of 25 men and women. And yet it only has 2 private restrooms planned and no changing rooms. And so you can imagine when everyone's getting up in the morning, there's going to be a rush for those 2 private restrooms and no space for anyone to change. And that is very important when you have a co-ed facility. And so it's very much about creating a space that is conducive to comfort and safety. And we're just pointing this out because it doesn't have the changing rooms needed. And I would also add, though there's space for a third restroom, I think the resources weren't there, or maybe the approval didn't happen at the right time, but 25 people and 2 restrooms. I mean, each of us in our homes have more than 2 restrooms usually, and it's only, far smaller than 25 people. So I'm just pointing out a ratio here, and that would be an important part to expanding the numbers there at IW Overflow. And then there also is no staff office planned in that space. So there's no space for staff to directly observe what's happening in that shelter area. Sorry to raise it here. It's just important for the transition to the new shelter spaces that we have planned.
Thank you for that point. Appreciate that. Ms. Harris, did you want to add anything just in terms of the transition and any support? I know HHS is providing as much support as it can, but anything else we might be able to do?
Yeah, nothing else to add. I think that we are fine for now. We have included the moving cost as part of the request for the supplemental, so we will be handling that. I think at this point we have what we need. It will be a bit chaotic because you're moving a lot of people. So it'll be a little messy, but we will get through it, and we will try and make it as smooth as possible for both our providers and, most importantly, the people we serve. So I think part of the strategy is to try and get as many people connected to permanent housing in the interim before we move, so it's a little bit less movement.
And while you have the floor, Ms. Harris, this is you've
Sure.
been doing really great work on a regional basis to address this issue. I know the Council of Governments has made this a priority. There have been numerous sessions, but as we know, homelessness is a regional issue, not just an issue specific to the county. Could you talk a little bit about, as we're discussing systems and building those systems out here within the county, how that is connected to our neighboring jurisdictions and what that looks like?
Sure. So the COG Homeless Service Committee and the Human Service Policy Committee have made this a priority of how do we encourage regional collaboration, understanding the needs across the jurisdiction. So our team is part of both the data sharing work group, which we have an existing data sharing agreement with Prince George's and the District of Columbia, and we have actually been using that and doing some data bumps, focusing primarily on veterans and who's on our veteran by name list, and then also now moving to chronically homeless and other vulnerable single adults. So that ensures that if people are bouncing across the different regions, that we're capturing them and that they're getting connected to housing, that they're not on everyone's list or on no one's list, that we are working with them, and that's at an individual level. It's also helpful to understand what are the gaps and the service needs. So different jurisdictions prioritize different things. Not everyone has shelter capacity. So using the data to understand it at an aggregate level is incredibly important. And then there's also the case coordination work group of the Homeless Service Committee of COG, and they're really focused on how do we help people move across jurisdictions. So if someone presents here at the crisis center, they have all their benefits and all their family connections are in Prince George's, how can we very easily connect them back to Prince George's and not serve them here, and vice versa. So that is ongoing and challenging, but we have made some progress, and it is at least helping us understand the gaps. I will say that we have seen an increase in the number of people coming from other jurisdictions, but I think that largely has to do with just being open year round where we weren't before. So I don't think it's actually more than what we would typically see in our winter overflow, which just we didn't have people from out of jurisdiction in our very small number of year-round beds that we had before. So just something that we're keeping an eye on and making sure that we're able to look at, help both the individual and then also look at trends and help the region advocate for additional resources.
Yeah, and
Does that answer your question?
It does. No, it's really helpful, and it connects to another dot that you had of an issue you had identified earlier, that there's a lack of long-term locations for these individuals to be able to go, particularly families, where you had mentioned being able to find maybe efficiencies or one bedrooms a little bit more easily, but even that's difficult. And so that is where I think the regional approach is going to be especially important as we look to transition people into more long-term housing options.
Yeah, I think that's a really good point. And a lot of jurisdictions have restrictions on if you're using DC money, you have to house people in DC. But there's even less affordable housing in DC than there is here. And so that's another part of the picture that we're trying to figure out. If the person is DC, but they want to move to Montgomery or they want to move to Prince George's because they can find something more affordable, how do we ensure that those services stay with them? And really looking at other sources of funding. So federal funding we can use, but local funding, it's really hard to justify serving people from another jurisdiction. But there's opportunities, I think, to fundraise, look at Kaiser, look at other philanthropy that are interested in a more regional approach. So, and that would give us the flexibility to house people across lines.
Absolutely. Now that regional coordination is not easy. This is on top of everything else that you all are doing day to day administratively. Moving forward, would it make sense for us, whether through a contracted position or somebody that we may want to consider adding to the team in-house, to be in a better position, because this is in addition to the 5,000 things you guys are already doing. But I think the regional approach is going to be really important for sustainability reasons moving forward. And so I think it would be powerful if there were some kind of a more formal agreement than the one that we have now, which is a little bit more organic between jurisdictions to address this issue holistically across the region. Would something like that be beneficial? Would it be helpful? Or do you think we've got enough of an infrastructure in place for the moment to work collaboratively with those other jurisdictions?
I think for the moment, we're okay. We have staff that we can commit time for this project. As we move further along and we get to a place where we're ready to have more formalized agreements, I think there is opportunity. We had talked before about having actually each jurisdiction having a liaison person, or 3, depending on the size, that could look at both trends that we're seeing, but also be like an outreach worker to actually help this person right here who wants to be in another jurisdiction, but they're currently in Montgomery County, to navigate the systems, because it's complicated in itself just here, but then to try and go across boundaries. But that didn't really get a lot of interest from the other jurisdictions, but I do think that would be something that would be really helpful. But it doesn't make sense for us to do it alone. We would need everyone to commit to that.
Absolutely. And Mr. Holland, Ms. Sinclair Smith, from the provider perspective in that regional approach, which I know you guys collaborate extensively with your sister organizations and governments in other jurisdictions, but if you could both shed a little bit of light on that regional approach and what your perspective is on that. Maybe Ms. Sinclair Smith, if you want to start.
Sure. Thank you, Councilmember Albornoz. I think I think connecting people back to their community and the resources and help that they had is a really positive capacity to have. I think that we all know how much our community and our supports mean to us. And so the ability to really focus in on making those connections, I think would be very helpful. We certainly, our practice at MCCH is and I might have changed recently, but we have been, if people come to us from other jurisdictions, we work with them for 30 days, and it takes our staff time away to work with them to reconnect them to the communities that they came from, from working with residents in Montgomery County who come to us who need assistance. So I think that could be very helpful, but I do think that a regional approach would be needed because I know I remember the day, I think it was maybe a Progress Place, so we had a big celebration amongst the 3 jurisdictions signing a big document. And I think that focusing on what it means to coordinate regionally, what assets and resources different regions have, putting sort of systems in place, I think is as equally as important as having an advocate for an individual to help them through the systems.
Yeah, we've similarly have seen a significant number of people from outside of Montgomery County seeking shelter. I think what I appreciate the most about the work that we're doing here in Montgomery County is that we prioritize the shelter first, and our message to clients who are out of jurisdiction is to help to reconnect them with their home communities where they can receive the most appropriate level of support. And that's the messaging that comes from our case managers, from our leadership. And we move pretty quickly, typically, to get people connected back to their jurisdiction. Sometimes it's as simple as helping to connect them back with their family members, making sure that we make them feel welcome, but also emphasizing that the best place for them is back in their home jurisdiction. Obviously, that's easier to do if their home jurisdiction is from DC or Virginia, harder to do if they're coming here from Texas. I will also say that the regional approach is really important because I also know that other jurisdictions also serve Montgomery County residents, and people sort of move in between. I remember working in DC distinctly that people were sort of sour that people would come from Virginia or from Montgomery County, and there was talk about driving the numbers. But I think that only highlights the need of the COG to continue focusing on that regional approach. And as a provider, we certainly are working to help people to connect to their home jurisdictions as quickly as possible, typically, within a week or two, to be able to return back.
I appreciate that. And Ms. McMillan, I would like to make a suggestion and Councilmember Glass has been in constant contact with our colleagues in the District of Columbia, Northern Virginia, as well as Prince George's County, and I really want to credit him for his leadership. I think it would be insightful for us to have a committee session after the new year. The dust is never going to settle, I'm learning in this job, but when we can potentially invite some of our partners regionally to have a broader discussion on that regional approach. I think it would be helpful and effective for us to sort of think that through, but also invite our partners from the state as well, which play a critically important role from a policymaking perspective as well. So let's maybe have more conversations about that, but I think that would be productive and helpful. So with that, Councilmember Glass, I yield back to you. And thank you so much for your leadership and that of everyone on this call.
Well, thank you very much, Mr. Vice President and Chair. And I think the comments that you shared are absolutely spot on. And I know that you and your team, in addition to mine, are part of those Council of Government conversations. And it was probably about 2 years ago now that I went into DC and toured a facility or two with Councilmember Brianne Nadeau, who chairs the district's HHS Committee. And adding to what you just shared or just said about inviting folks here. We did have something in the works, I think, to go to an MCCH facility, if memory serves, in the pre-COVID time, but then COVID happened and everything stopped. And so let's absolutely pick up this conversation when the time is right and bring some of our regional partners and state partners and members of this committee and whomever else wants to come to talk about our regional approach here. But Mr. Vice President, you're exactly right, and appreciate those comments. So that is it for me and my colleagues. And so I just want to thank all of you for sharing with us the status updates on where you are and where we all want to be come January 1st, 2022. I know it is going to be an exciting few months. I know that it's not going to be easy picking up and moving, but when we move our facilities, whether it's to Crabs Branch or to Neville Street, the opportunities that it will create for your organizations and some of our most our residents in need here in Montgomery County are going to be huge. It's going to be a game changer for them and their ability to get healthy and to get housed again. And to the other points that we've been talking about, it also creates more opportunities, renewed opportunities for residents to reconnect with each other, for our rec centers to reopen, and for our communities to thrive once again. And that too has not been an easy process over the last 18 months. But again, I appreciate Council President Hucker fighting for the communities, advocating for them, and there is light at the end of the tunnel for everybody involved. And so I'm glad for that. And so now that we've had this conversation, I'll turn it back over to Ms. McMillan for the second item so we can put our words into action here.
Thank you, Councilmember Glass. Yes, you have before you a request from the county executive for an amendment to the capital improvements program and a special appropriation of $2.455 million. I do just want to say, in order to make sure that the council moves on this as quickly as possible, we're doing it a little bit out of normal order. It actually will not be introduced until tomorrow, but it was fortuitous that this was already scheduled. So staff is asking the committee to make a recommendation today. It will be introduced at council tomorrow with public hearing and action scheduled for November 30th. I do just want to point out, it has not even been a year since the first appropriation for this project. It was back in December. The council moved expeditiously with the executive to put money in to find a location, then came back a couple months later to put in the money to get started. So this has been a fast moving project. I also say that because, as you heard Mr. Dice comment in response to Mr. Rice's questions, you'll see another phase to this. There are things that have come up that weren't quite expected in the initial appropriation, and there are things still to be done, whether it is exterior work at the building or landscaping, or working eventually to bring in some more energy sustainability into the building. But everybody's working as quickly as they can. And so this additional funding is needed now for several items that have come up that weren't expected. The primary one being some roof replacement work that wasn't expected in the original appropriation that you gave. So council staff recommends that the committee recommend approval, and we would then note that when we get to public hearing and action.
Okay, well, I'm always game for putting the cart before the horse on a really important issue like this. So let's go for it. I know that Councilmember Rice, I think he's in transit, I believe. So
Correct, but I'm still here.
There you are. Good, as always. So I defer to my colleagues if they want to move this item. Mr. Vice President?
I would suggest that we move the special appropriation.
Second.
There you go. Vice President Albernaz moves and Councilmember Rice seconds, and all those in favor of this item say aye. Raise our hand.
Aye.
There we go. Unanimous. And I'm sure Council President Hucker, there you go. Thumbs up. He absolutely agrees. Anything to do to open these facilities sooner and get life back to normal for all residents in Long Branch and Littonsville, I know he supports as well.
Thank you very much.
Okay, and I think that is it. A really good conversation. Lots of different follow-ups that a number of us mentioned, but I will turn it back to Vice President Albornoz to close us out if he chooses.
I think you've covered it. I think we can adjourn. Thanks, everybody.
Yeah, have a good day.
Stay safe, everyone.